Welcome, everyone. So, the big question is, when should you see a fertility specialist? If you've been trying to conceive for a while and you're wondering, do I actually need help or what's going on? We're going to answer your questions on this Facebook Live. I'm here with Dr. Daniel Groh. He's from the Center for Advanced Reproductive Services. Dr. Groh, thank you for being with us.
Well, thank you for having me. It's really nice to be here.
A lot of people think age is the big factor. Like, oh, once I get to a certain age, I just might not be able to have a baby anymore. Is that still the most significant factor?
Yeah, that's a great question. Age is a big factor. And, fertility peaks in when a woman's in her 20s and stays pretty level up until the early 30s. And after that, it starts to fall a little bit each year. And so that's what we struggle with many patients. And so a good rule of thumb is that if you've been trying to get pregnant for a year or more and you're under 35, it's probably time to see a fertility doctor. And if you're over 35, we say 6 months of trying and you should see a fertility specialist. If you're over 40, because age has such a profound effect, after 3 or 4 months, you should probably see someone to help.
Okay. And there are some medical problems that would impact fertility, like endometriosis or PCOS, or maybe you don't know, like you just have irregular cycles.
Yeah, so the two you mentioned are two of the most common that we see. And women with endometriosis often know it because they have pain. And, those patients have inflammation that makes it harder to get pregnant. And it really halves or more than halves the pregnancy rate each month. So we'd love to see patients with endometriosis. Polycystic ovarian syndrome, those patients often don't ovulate regularly. So they don't have regular cycles. And so that's a very easy thing to treat. It's very satisfying to treat and help those patients. So we see a lot of PCO patients. Another that you didn't mention that is very common is abnormalities in the sperm. So we have men with low sperm counts or low motility or some abnormally shaped sperm, and there's lots of things we can do to help those conditions too.
How common, we often think of the woman, and I know you need to check your own health, but how common is it that the infertility is because of the man?
It's about 40% of the time.
The 40%.
So where the women are, normal and the male has a problem with his semen analysis.
And these are things that you can check right there you're at the Center for Advanced Reproductive Services, and you've got the technology to determine. So if a couple comes in, you're going to be able to tell them what's going on usually?
Oh, yeah. So, with initial visit, we'll usually order a full panel of testing to include a semen analysis, a test to make sure the uterus is normal inside and the tubes are open, called a hysterosalpingogram. It's a tongue twister. And, we also are very focused on a patient's health. And so we help them, find ways in their lifestyle where they can be healthier. And we do some hormonal testing and things. So we want to help them to be as healthy as they can be, but also find if there's a problem preventing pregnancy.
Okay. And you also have some genetic screening, and this is important because perhaps you have a rare disease in your family, or there's things that we can correct for, or at least prepare for, that we didn't used to be able to do, right?
Yeah. So, one terrible disease that many of us know about is cystic fibrosis, right? And we know, and kids live a terrible childhood with CF and often die at a young age. And so if you're a carrier for CF, as many of us are, it's about 1 in 25 of us are carriers, and your partner is a carrier, then you have a 25% risk of having an affected child. So there's genetic testing of embryos available through in vitro fertilization that can prevent that. Other conditions, we have patients who are carrier of cancer genes, BRCA and other cancer genes, and we can now test embryos to prevent their children having these cancer genes and perhaps dying from the cancer of other family members have died from.
Yeah, I mean, it's really amazing, some of what's available to couples now. Also, egg freezing. I know a lot of women have maybe put off having kids. They're starting their career or they haven't found the right person. How popular is egg freezing now?
It's getting more popular. And, we have many professional women who, because of life and career and other things, push off their, starting a family until after their career is established. And so many times these women will come in and say, I really want to have a family, but I'd like to save some eggs, preserve some eggs. And egg freezing is a pretty mature technology. We do it very successfully, and it's led to many children, to many women having children. Another time where we do that is if there's a cancer diagnosis and a patient is looking at chemotherapy, which has toxic effect on the ovary, that we can save some eggs first before they start chemotherapy.
Yeah, and these are actions that people can take. If you are listening to this and you're thinking, well, I've been trying for 6 months or a year, depending on your age, is the first step to make an appointment?
Yeah, and we actually really love what we do. We love seeing patients and helping them, and we'll do a 1 hour visit face to face, sometimes live, sometimes through telemedicine, to take a complete history and find out how we can help improve fertility and do some testing, which may lead to treatment and often success.
And these appointments could even be done virtually, right?
They can. And right now we're doing only virtual appointments, but soon as COVID comes down, as thank goodness, we'll be seeing patients face to face again. But I think patients will continue to have the option. So I've done many visits, in patients' cars or at work or, and it makes it very convenient actually.
Right, and obviously, if you need to get some of the treatments, you would go in person. But if you and your partner are both working, then this is great because you could do a consultation over the phone with both of you being in different places, and it's just perhaps making it a lot easier for people to get in. And you can call. We have the number on the screen right now, Dr. Grow. It's 844-467-3483. It's 844-467-3483. That's the Center for Advanced Reproductive Services. Or you can go to the website and learn more. UConnfertility.com. So some really easy ways for people to at least have that conversation and see what the next step could be for them.
And we have, one of the most compassionate group of doctors and nurses that I've ever encountered who really enjoy their work and helping patients. And so if you find yourself in this position and need help, then we have a wonderful resource here locally.
Yeah, and I've had a chance to meet you and many of your team over there, and great doctors. I know they also have some support groups, Facebook groups to help women who are going through the procedure. And also, you're open for everyone, right? Because there's all different kinds of families now, and I know you've helped a lot of same-sex couples. You can also help people find surrogates. There's really full spectrum of what you're able to help people with.
It's truly a full spectrum of care. And again, we truly love, treating patients who want to have families. And it doesn't matter who you love, we'll help you, create a family.
I know it's exciting for many folks. And I'll just put up the number and the website one more time. And perhaps you want to share this with someone that you love and get them the information. It's 844-467-3483, UConnfertility.com. Dr. Grow, thank you so much for sharing some time with us today.
It was really a pleasure. Thank you for having me.
Absolutely.
I appreciate it.
Absolutely. Good luck, everyone.